Hey, Muavinaka, and welcome to another episode of Health Talk with Oceania Hospitals. I'm your host, Alex Navilati. A massive thank you to everyone that have been following our social media pages and right here on YouTube. Thank you for the subscriptions and the likes. A massive Vinaka to everyone, and you've all made this couple of episodes possible. Vinaka Vakalenu. Today with us in studio, we have none other than the nurse manager here at Oceania Hospitals, Mr. Jonetani Rokoua. Jonetani, welcome to the show. How are you?
Well, Alex, I'm glad to be here. Thank you for having me.
Thank you. Just before we start, could you just kindly introduce yourself? Well, just a bit about your history and brief background that eventually led you here to Oceania Hospitals.
Alex, my name is Jonetani Rokoua. I'm originally from Vunuku in Rel. I've been in the nursing services since 2001. I can proudly say that basically throughout my nursing career, I've been in mostly in the private sector. First posting was at Bar Mission Hospital, then it was managed by the the Methodist churches, and I spent 2 years there. Posted to super private hospital back then. After that, I spent 2 years, went abroad in Australia, worked as an agency nurse. Then for 7 years, came back, joined the non-civil society organization known as FRIEND. I was a community health manager, back to super private, and until it's recently named Oceania Hospital. So I've been here since 2006, called an old.
Thank you, Jonathan. You know, it's quite an interesting journey. It's also quite inspiring. I'm sure our younger viewers who are currently pursuing a journey through this career path are listening in as well. And that's very inspirational. Thank you for that. You know, just we're going to divert into the services provided here by your nursing team. Could you just briefly touch on that? What are some of the services that is provided here by your team?
Thank you. Our nurses work mostly in all areas of the hospital settings, starting from medical sector as outpatients and emergency services. We have theater nurses, we have the cath lab, we have renal nurses as in dialysis unit, and in the wards where they work in medical, surgical, and also maternity.
Thank you for that. You know, it's only fitting that we've got Jonathan here, because this week we're celebrating International Week. You know, it's just to commemorate all the nurses that have called before us, and it's also to acknowledge the services, the clinical services provided by the nurses in our medical, in the medical sector, not only in Fiji but all across the world. And we started on Monday, and it's going to end on the 12th, which is next Monday. Just touching on that, you know, do you have what does this mean for you and the team?
Okay, thank you, Alex. For these starting today, it's from the 6th till the 12th. It's usually Nurses Week, and culmination on Monday, which is the International Nurses Day. This to celebrate the birthday of the founder of nursing, Florence Nightingale, more than 200 years ago. So for the nurses, we celebrate the incredible contributions that they put into the hospital or whichever facility that they work in.
Thank you. Just trying to connect these two together, you know, a lot of our younger viewers, especially in nursing school right now, are planning or already on the journey towards this career path. Do you have any advice for them for this upcoming nurses?
You know, if you want to be a nurse, you have to, first of all, you need to be caring for, you know, that should be inbuilt in you. You have to be having that caring attitude. You have to be compassionate. You have to have a good communication skills. You have to be courageous, because you're going to handle bloods, urine, and bowels for other patients or other people. And you have to have a sense of commitment. You know, like you'll be working 24/7, literally. You'll be working on a public holidays when your friends and families are resting at homes, in the middle of the night when people are sleeping. And the last thing is you have to be competent to practice as a nurse.
Thank you. You know, We have a lot of patients that come in on a daily basis. Could you share with us just some of the challenges that you and your team face? Yeah.
It depends on case by case basis. So it depends on the type of challenges that comes up. But we are lucky at our facility that everything is provided. We have access to consumables, and the management is supporting our nurses. So we basically are happy. But we think about our colleagues outside of the facility who are going through some of the challenges that nurses face every day, which are consumables, to name a few, the staffing level. So as a nurse manager, my role is to ensure that we have enough staffing, that our nurses are supported, and we work with other departments to make sure that things are carried out and the patient's care is not affected.
Thank you. Just to conclude, do you have any advice for our viewers or, patients that probably come in, and especially in terms of general care back at home with parents and children? Do you have any advice? Just a general advice.
For us, we are always open our doors to you 24 hours. We pride ourselves in giving the most excellent care. And first of all, when you're at home, look after yourself, look after the children. And if you're sick, we'd invite you to reach out to us at Oceania Hospital, and we'll be able to try and help and assess and deal with the care that you need.
Thank you very much, Jonetani. And there you have it, ladies and gentlemen. Those are just some of the services. Basically, we're touching in general right here. It's just the tip of the iceberg. And later, during the season, we'll dive into a few more episodes. And that's when we dive into the different types of services, the challenges faced, and everything that goes on behind the scenes here at Oceania Hospitals. And because at Oceania Hospitals, we do care for you, and we try to keep the utmost standards in patient care and clinical services. And not only that, a massive thank you all the nurses all across the world. Thank you for your services. Thank you for everything that you do for us. And we'd like to wish you all a happy International Nursing Week. So from us here at Health Talk with Oceania Hospitals, till next time, Binaka Wakalin.